Welcome to this presentation of Meet the Experts AYA edition titled Emotional Support Resources for AYA Patients and Survivors with our expert Olivia Loginski, Clinical Outpatient Social Worker at Moffitt Cancer Center. AYA Meet the Expert is brought to you by Moffitt Cancer Center, Patients Library and Welcome Center, and the Adolescents and Young Adult Program. Please visit moffitt.org Meet the Expert to see our upcoming sessions. The content in this presentation is not intended to be medical advice, and the viewers should consult their physician if they have any medical questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. If you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because you watched this presentation. Now, please welcome our expert, Olivia.
Thank you, Karen. So as Karen mentioned, I am Olivia Loginski. I'm an outpatient social worker, specifically in the sarcoma clinic, and I have the opportunity to present on navigating your emotional health as an adolescent and young adult, which can span over a spectrum of new diagnosis all the way into survivorship. So to start us off, I'm going to talk about the unique AYA challenges within this population. According to the National Comprehensive Cancer Network, for the AYA population, these are the unique challenges that they face. And so we see oftentimes a delay in diagnosis, an adjustment time transitioning from maybe being very independent to those dependent stages of life where you were living on your own or had your own job and then becoming dependent on those social supports, which wasn't something you were used to. Oftentimes financial toxicity of those financial stressors, balancing the cost of medical bills, personal bills during treatment, fertility preservation and infertility. I'm going to get into a little bit more about that later. Lack of satisfaction with the available resources. There's such a significant amount of resource and education and research about the pediatric population and then with the population of 40 and above. But the AYA population falls short with resources sometimes. And so not only will I highlight some of those resources, but I often see that there might be a lack of satisfaction with resources for college or possible deferment or resources paying for COBRA or losing your job and then losing your insurance and not having income, but not being eligible for disability and how to navigate that. Clinical trial eligibility, and last, a survivorship transition. Oftentimes, there's such a disruption to many aspects of an AYA's life. We see individuals come in with young families. They might be working or in school, again, losing that insurance or getting that student debt. This is such a unique stage of life as a young adult. Their emotional, cognitive, social development are still in unique stages, and that cancer really disrupts that. These young adults are attempting to establish independence from their parents or from their role models. They're entering the workforce with a desired career, finding a life partner, raising a family, and then sometimes this cancer comes in and entirely derails those plans. And as you can imagine, it's a significant impact to mental health and emotional health. So some of the biggest symptoms of that are isolation, depression, and anxiety. And studies show that these disruptions to that's a very common reaction to that disruption. And we see in a developmental stage, socially, it's going to impact their peer-to-peer support. It's going to impact their dating life. And there was a really interesting study. It's called the AYA Hope Study by Parsons. And they said that AYAs with cancer often spoke about how their friends no longer called them or they had a difficult time maintaining those relationships, that sexual relationships were difficult to maintain. There was within the AYA population, social activity among AYAs often involves drinking alcohol, and which is really problematic when an AYA is in treatment or undergoing cancer treatment. So dating can be challenging, balancing that social life, balancing a romantic partner, and they have to look at how is this going to impact my long-term survival and ability to have children. So those future plans cause a lot of anxiety as well. I wanted to talk about coping with cancer. When looking at those unique health challenges, we have to really shift focus and learn to utilize healthy emotional responses and also just provide validation that these emotional responses, whether it's this shock or disbelief or distress, which could include anxiety or anger or low mood, and then this adjustment, those are all very, very natural emotional responses. This is a very vulnerable time in a patient's life, whether it be time of diagnosis, whether it be awaiting treatment issues, whether it be discharge or recurrence of disease, progression of disease, end of life. You have to allow yourself some grace to respond to that. And there was a really interesting article by Tara Hale, and she talks about surge capacity. And really, this focuses on the lack of focus and energy and patience that one would have when experiencing crisis or really stressful situations. So she says it's a collection of adaptive systems, mental and physical, that humans draw on for short-term survival in acutely stressful situations. And so what she looks at is, okay, let's say in an acute stressful situation, such as a natural disaster, you can kind of overcome that in a short period of time, and then you have some recovery. But with the chronic illness, the disaster itself stretches out over everything. It's going into your personal life. It is affecting your relationships. And so how do we kind of refill and recharge our battery? What do we draw on for this short-term survival to get over some of those hardships? And I ask too, how have you previously adapted or coped in the past? Because it's important to look at, okay, when there was crisis in my life, how did I manage that? What was productive for me? And now reshifting and saying, what's going to be a new normal? How can I create that in my life? There's this myth to be positive all the time in this cancer world, in the world of oncology. And you don't have to be positive all the time. There's no right or wrong answer of how to cope. So I just encourage you to give yourself time to adjust and ask for help and mobilize those social supports. Next, talking about the emotional impact that a diagnosis could have. It is such human nature to search for a reason and say, why did this happen to me? What caused this? Our logical and analytical self kind of kicks in and it tries to offer our brain an answer. And so fear about what cancer is going to do to our life and all of the impact of it, it's going to affect the strongest of individuals. And it can be really difficult to not know how to navigate that. So it's important not to blame yourself or to blame other things. It can cause a really false sense of security. I always will say never to overestimate danger and setbacks and never to underestimate our ability to cope. And when we are distressed, we often can go into black or white thinking, that really rigid thinking of this or that, where that's not the case. So I want to demyth if treatment isn't 100% successful, it doesn't mean it's useless. It doesn't mean that you can't enjoy your life. If you can't work out like you used to, it doesn't mean that you still can't move and take some time to adjust to something that does work for you now. And distress can really increase when isolated. So mobilize those social supports, find those quality humans that you can process with, that they might not have the right answers. They might not know exactly what you're going through, but they are listeners and can help offer some support, whether it be running to the grocery store or being at the other end of that phone call when you're having a tough day. And then becoming aware of when we have dysfunctional thinking patterns. These unhelpful thinking patterns, they can be Examples of that could be catastrophizing, thinking of the worst possible thing, or overgeneralizing, jumping to conclusions, assuming that we know what the other one is thinking. So ask yourself, to reframe that, what evidence is there that this thought might be true? And the reason I'm talking about this is it could be a really great way to manage anxiety, of saying what evidence of this thought, of this anxious thought, is true or possibly not true. What is the effect of continuing to believe this thought, whether it be anxious thought or depressed thought? What could happen if I changed my thinking? What would I tell my friend in this position? So those are just helpful questions to kind of reflect if you're having trouble motivating yourself. Start with 5 minutes of it. Start with 5 minutes of, rather than thinking I'm never going to exercise again, and I'm never going to be able to bike like I used to. Well, take 5 minutes to go outside and maybe walk of what you can tolerate, or take 5 minutes of talking to a loved one. That's really helpful to work through those stressors. And I like the quote from Eleanor Roosevelt. She says, "You gain strength, courage, and confidence by every experience in which you stop to look fear in the face." Next, everything has changed. Once you have a diagnosis, it's very overwhelming to think, okay, what's next? And so we ask, okay, what used to cause us stress? How has that changed? There's no reason to believe that you should be managing all of this very well. There can be feelings of hopelessness. There can be feelings of helplessness. It's important to recognize that these reactions are so normal. And managing that uncertainty of, okay, what used to work might not work anymore. It can be overwhelming, emotional, and you might question yourself. So I say, please speak to someone about understanding this. How can you assist in balancing those options? How can you talk to someone about managing those stressors? Because there's not a clear choice. There's going to be so much uncertainty in what's next, what's my future look like. And in this position, I encourage short-term goals, short-term attainable goals that you can work towards, rather than saying, oh, in 2 years, I'm not going to reach this in 2 years, or I'm not going to reach this in 6 months. Like, focus on the present, because that fear of the future can only initiate more anxiety. And the providers really manage uncertainty as well. So talk to your care team. Say, I want to have a conversation about the resources that are available. I want to make informed and shared decision making. And that is a way to advocate for yourself. A shared decision-making model is basically introducing a choice, and then you and your care team talking about the options, and then exploring your preferences for those decisions. And it's a really intentional patient-provider engagement. It has long-lasting benefits both for the patient care and for the patient-provider relationship. For more on advocating for yourself, I will always encourage to write down questions and ask specific questions about your treatment before it begins. Or if you're in treatment, there's never a bad time, or you're never going to feel, I have patients that'll say, oh, I feel stupid for asking this. No, please ask the question. Please advocate for yourself. If you don't understand something, ask your medical team to explain it in a different way. If you forget something, ask about it again. Bring up the questions and plan for side effects. And it's important for you to know how to manage those and important for your caregivers to know how to manage those. So ask the questions. And also, I will always say, tell your medical team how you want your caregivers to be involved in your care. Whether that be your immediate caregiver or people in your family, what information they might be able to access. And then lastly, fatigue. Acknowledging that fatigue, it is the most reported symptom of cancer, most reported symptom of treatment, and it can interfere so much with a patient's just activities of daily living. So this could affect your motivation, it could affect your mood, it could affect your feelings of being so overwhelmed. So just acknowledge that this is going to be an adjustment, and how can you rely on some other people to help support you through this. There's this article from mindful.org and they call it Stop. And when you're stressing or when you're anxious, the worst thing that someone can say to you is just stop and don't do that, or stop being anxious, or stop stressing out. And that's so unproductive. But there's an acronym, STOP, that can be productive. And this article talks about how to create space in a day to come down from a very worried, anxious mind and how you can mitigate those negative effects of our stress response. And so it basically breaks down stop, take, observe, and proceed. Stop is stop what you're doing and put things down for a minute. Take is take a few deep breaths. You can extend that for more than just a few deep breaths. You can extend it for minutes. Follow your breath. You can even say to yourself, okay, I'm breathing in, I'm breathing out. You're bringing presence and mindfulness to your breath because that is an autonomic response that we can control. Observe your experience as it is, whether you're observing your thoughts, you're observing your behaviors, your feelings or emotions, or reflect what's on your mind. Notice that these are thoughts and not facts, and they're not permanent. Notice those emotions are present and how they're being expressed in your body. Research shows that naming these emotions can turn the volume down on the fear circuit in our brain, which is so interesting, and it really has a calming effect. Proceed with something that will support you in the moment, whether talking to a friend or rubbing your own shoulders, or just like there have been really good results with tapping and bringing your anxiety and heart rate and breath down. Have a cup of tea or go outside and get some fresh air. Treat this exercise as an experiment. Look at it as, okay, I'm gonna include it as a intervention and a resource when I am feeling stressed or anxious. This slide could be a whole presentation in itself, but I didn't want to talk about the emotional challenges within an AYA without touching on it. So self-image and sexuality. There's a really great article on cancer.gov about coping with cancer and self-image. And so one of those things is coping with body changes. For many, cancer treatment brings changes to the body in so many ways, whether that you can physically see them or you can't physically see them. Some are short term, some are long term or forever. And this can be a big concern for young adults or even anyone going through body image. So there could be certain medications that are causing changes in swelling or fluid retention. There could have been surgeries. Hair loss is such a huge one from chemo or radiation. Skin changes, weight changes, loss of limbs, ostomy bags, scars. These are all real. It's so okay to be upset about them. And look at these feelings of whether it's anger or grief about the changes. These are natural feelings and natural emotional responses. So mourn those feelings, mourn those losses, and know it's okay to be upset about it or sad about it or frustrated. Your feelings are very real, and you have to have a right and productive way to cope with it. So as a mental health clinician, I will always advocate to seek help if you need to talk to a therapist, if you need to talk to a counselor. Those resources are available, and I will touch on those at the end. But focus on ways that you can cope with your cancer to make you stronger, more realistic, wiser. You can talk to a support group, find a community that could be so helpful for you. With staying active, there can be some adjustment to, I was so active before and now I can't be, or my life just looks different. You may find that being active helps you cope with those changes, and it can reduce your stress and improve your relaxation, which is incredible. But start slowly, and if you need to take your time, that's okay. Again, giving yourself that grace of, I used to be able to run 5 miles, no problem, and now I can't even walk 5 minutes. Well, slowly and surely, let yourself and give yourself the time to do so. Changes in your sexual health and fertility, these are all really such vital parts of a young adult's life. and this could be another presentation in itself, but sexual problems can last other than the side effects of a cancer treatment. So it's important to talk to your doctor if you're concerned about it. Talk to an expert. How do I adapt to these changes? Those are realistic questions that and common concerns that you could have. It's okay to be worried about intimacy with your partner. It's okay to be worried about changes in your sex drive, changes in those sex organs, menopause symptoms because of treatments, losing the ability to have children. These are all incredibly impactful things that can weigh heavy on you. And so I encourage you to talk to your partner if you have one, or talk to a loved one, talk to a mental health professional. If you do have a partner in your life, share those feelings and concerns. It's important to be upfront and direct as to where you're standing and what you see in your future. Even couples that have been together for a long time, it can be difficult to stay connected. So try to stay open about your feelings, stay positive, and try not to place blame on anything. There can be ways to stay intimate, like focusing on just talking or renewing a connection without being physical. And protecting your time together. Turn off the TV, turn off the cell phones, or put the cell phones away and plan that time to be really present without being physical with your partner. And then dating life. If you are single or you are navigating the dating life, you're worried about body changes or concerns about sex, it can really affect how you view dating. And as you struggle with whether there be changes in yourself or just the adjustment of okay, how do I bring this up on a date, or how do I bring this up to a partner? Those are common concerns. And you may wonder, how will someone react to maybe my physical changes? How will someone react to hair loss or my scars or my ostomy? It can feel awkward to bring up those conversations or those sexual problems or the loss of fertility. It's not. I'd be remiss if we'd pretend like that's a easy conversation to have. But you don't have to feel like you don't have the opportunity to be in social situations and still maintain these relationships with people in your life because of what you've been through. And focus on the activities that you do enjoy. Focus on a sense of trust and friendship with a new individual you might be dating before you tell them about your cancer journey. And don't let cancer be an excuse to not meet new people. I really would say to perhaps your cancer experience gives you a sense of purpose and appreciation for a relationship that you might not have had before. And there's a way of reframing that. I wanted to touch on some available resources in the community and then also on the right side within Moffitt. In the community, as many of you know, there are the Moffitt AYA page has an event calendar and many resources. The AYAcancerconnect.com is the Moffitt AYA page as well. However, it is a resource for any patient outside of Moffitt, and we have it broken down between financial assistance and emotional support. So please navigate that. We hold events monthly, whether it be a virtual game night or a networking dinner locally, holiday parties, boat cruises for you to connect. And that's really important for you to find that community, to adjust and find people that really are walking in your shoes. And with that being said, Immerman Angels, it's actually a global resource that has a database to match patients. And so what they look at is trying to find a mentor with your same diagnosis around the same age and within the same area. So that's a very incredible referral source for you to connect with people. We have Psychology Today. As a social worker, I want to identify that there is counseling and sources of support in the community for patients. And Psychology Today is a directory for therapists. You can put in your zip code, use the drop downs for insurance and specific issues. There's a drop down for chronic illness and seeing if there's providers that are familiar with navigating oncology. There are some other resources like Cancer and Careers, Cancer Care, the SAM Fund. SAM Fund, that is specific an AYA resource for financial assistance. They open it up a couple times a year. One is for financial assistance for general patients in active treatment, and the other one is for fertility purposes and assisting with the cost of cryopreservation. There's the Cancer Support Community, an incredible resource. They have coordinators that are available on the helpline to help navigate patients. They have a list of financial resources, a really great website, and Livestrong, if you're interested in moving and exercising and looking into those free low-cost programs, Livestrong is a resource. Here at Moffitt, I encourage every single patient or caregiver to look into the support groups. So every Tuesday, we have the patient support group from 1 to 2, facilitated by us social workers each week. And then we have a caregiver support group every Wednesday at 1. And these are virtual groups, so they're accessible for everyone. If you're trying to reach your social worker at Moffitt, that is the main office line to help navigate you on which clinic and social worker you're assigned to, outpatient or inpatient. We have integrative medicine services, whether it would be massage, acupuncture, mindfulness, yoga. We do have a behavioral health program at Moffitt under the umbrella of supportive care. And if an individual is in active treatment, then they are eligible for referral to see a psychologist or a psychiatrist. And so I always want to highlight that. We have dietitians available for nutrition, education, and navigation. And lastly, a survivorship program at McKinley too. I didn't mean for all of these to come up. There's a bunch of them, so you can keep looking through. I didn't mean for all of them to come up so slowly, but I just wanted to offer a slide that really shows what else social work can support. And the goal of social work is to be present and to engage a patient with empathy and to be a compassionate listener. But our role is looking at, okay, how do we address these emotional needs of a patient? How do we assist with access to resources? How do we foster a really safe and expressive outlet and space for a patient to process this, or for caregivers to process this? How do we collaborate with the medical team? How do we offer an opportunity for patients to discuss how their cancer is affecting them, whether it be emotionally, financially, physically? And this just kind of provides a visual of all of the different services and variety of them. You can always ask to speak with your social worker in the clinic or call the social work office. And we have to be knowledgeable in our resources throughout the community and assist patients and their families in managing the impact of a cancer diagnosis. So we can screen for depression and anxiety. We are often looking at addressing distress, because distress can be a scanxiety coming into an appointment, or distress can be related to a recurrence of disease, or distress can be related to things, personal bills or finances in the home. And so talking to a social worker, we can discuss, okay, what resources are available? How can we encourage self-care? How can we help manage that stress? What are ways we can navigate this? What are resources at home that you might be eligible for? And then lastly, providing support to the families and caregivers of these patients too, who are challenged with caregiver burden or a loss of a loved one. So it's just a visual of the social worker department and how we can support our patients and families. This is my information, my direct line. I am, again, the social worker in the sarcoma clinic and the AYA lead in the department. So if you have any questions, please reach out, or I can navigate you to the right social worker. There's Again, lots of education in the patient library, and always check out our AYA Moffitt page. If you ever did need to get in contact with our AYA coordinator, they can be reached at aya@moffitt.org. And because of the timing of this presentation too, the holiday event is approaching in December. Thank you all for your time.
Thank you for viewing these sessions. We offer live Meet the Expert sessions through Zoom. To see a full list of upcoming sessions, please visit moffitt.org, Meet the Expert, or call at 813-745-1690.